So welcome to the Kane Education YouTube channel. In this video, we will discuss about the code of ethics. So first and foremost, we'll see about the what is the difference in ethics and morality. So ethics and morality, as we all know, that ethics is a rules and regulations that we have to follow. That may be the that will makes the profit for the hospital patients. Okay. Yes. So the morality is that the personal belief. It's a personal belief about the right or wrong. Okay, that is morality. Okay, what is the meaning of morality? Suppose if I say, if the blood transfusion, example, the blood refusal by the patient. If suppose any the patient is refusing the blood transfusion, okay, we will say, hey, it is bad. We should administer the blood transfusion for you. You should not tell that bad thing. So that is right or wrong is a moral, but when it comes to the professional rules or principles, that time if the patient is saying blood transfusion is not needed for me, that is not needed, that is a decision of the patient. So when the patient is deciding to not take the blood transfusion, not to take the treatment of the blood transfusion, then we should not give. Okay, so that is, we can say, autonomy is one of the ethical principle where the person or a patient or a nurse profession can have the ability to make the decision. Clear? Okay, that is the ethic. Next, here the morality depends on what? That maybe depends on the family, okay, individual, or a religion or a culture where it will become one of the source. Then what about ethical is a, it is based on the International Council of Nursing, or due to the based on INC, Indian Nursing Council, right? So based on that, whatever the ethical principle and legal aspect is there, based on that, that will carried out in the hospital setting, right? So here the morality is a subjective, that means one's own feeling, but here the ethical is objective and standardized. So it has already standardized some of the laws, and some of the rules have been already done mandatory. According to that, we need to lead the professionalism, right? So yes, morality, if the morality is, if you show them, if you are not, if you are showing the morality, then there is a no punishment for that. But if you are not showing the ethics in the ethical consideration, if you are not doing the ethical consideration, and if you are doing the illegal, that time it will be having the punishment, it will be having the punishment, right? So example, so if the blood refusal by the patient is a, if you can say that is bad, that is moral. So blood refusal by the patient is a right, it's a their right, they can refuse, it's a decision of the patient, they can refuse, right? Okay, coming back to the values. Okay, so values means what? One who can give the believe that about the worth, okay, worth of something. That may be the money, that may be the time, that may be the energy, there is some value. Okay, there is some value means the worthiness. Okay, so time, money, energy, so based on whom we have to invest our time, with whom we have to invest the, where we have to invest the money, and where we have to uh, show our energy. This is, we can say, that is what we are valuing for. If you are making the choice of values like health and illness belief or health practice, are we giving the value of the health practices? Are we behaving perfectly in the healthcare settings, or in the college, or somewhere after the nursing? Okay, after entering into the nursing field, are we giving the responses to the illness, human response to the illness? Okay, next, development of values. Okay, so how it has been developed? Here the values is not from the born, okay, not from the uterus itself. It is inherent. Okay, it may be inherent, but not from the birth itself. Okay, and values are developed throughout the life. Clear? Okay, next, sir, throughout the life means what are the sources are like environment, okay, based on our environment, based on our family, based on what the culture is, and the school and peer group societal members, that also depends the what the value, how we are giving the value to others or how we are getting the value, right? So children learns the values by observing the others or by imitating their model, okay, or their influencer. And child in that whom they want to observe or whom they want to imitate means that is about their very importantly the family parents, they will observe more and they want to imitate according to them. So it's a very important, and what is the most important, so that one they will observe, and what is the most acceptable and unacceptable, that will observed by the child. Clear? Okay. So if they ask in the source which one is the most important, that is family is the main source for the valuing some valuing to others or valuing themselves, right? Okay. Next, common modes of development of values. First one, modeling. What is the meaning of modeling? Modeling means here they are the children is or the nurse is observing the patient learned their behavior based on their parents, okay, or their peer groups or their teachers. It's a most powerful value of learning, right? So moralizing. So moralizing means the teaching the values by telling what is right or what is wrong, that is moral, right? Okay, using the rules and standards, this is ethics. Clear? Okay, helps to develop the socially acceptable behavior. Next, laissez-faire. Laissez-faire means already the children is developing their value by little guidance of their parents, okay. So guidance is coming from the parents, but what happens sometimes misguide also may come, or the guide may come with only lack or the deficit we can say. Deficit means only few things, few guidance we got, but we not got fully. So that time that may lead to confusion or conflict between them itself. Clear? Okay. Next, reward and punishment. I think I said already. See here, anything if it is rewarding or anything if you are getting punishment, that time what happens, the reward and also punishment. By rewarding you will do the good behavior, more good behavior you will do. Sir, what about by giving the punishment, you will uh, you will be you will be away from the bad behavior. So you are ultimately we are increasing the good behavior only. So that is rewarding and punishing. Clear? Okay. So reinforcement, where we can increase the good behavior and socially acceptable values. Clear? And a responsibility, they have to make the decision, who? The nurses. And they have to make the independent value system to everyone, that may be colleagues or that may be the patient. Sir, what are the values that are essential in professional nursings? That is, so their value is neutral. Please do remember, the nurse's value is neutral. Someone said something, that time your value never goes down, or something someone will tell you something about you more, that time your value will not goes up, okay, it will be neutral only. And what about your about the character, it is non judgmental. It is non judgmental. You are doing about the professionalism, your professionalism is neutral and non judgmental. Whether you are making correct profession or not, that only depends, not on your character basis, not on your personal basis. Your personal and character judgment is not needed for the professional nursing. Clear? Okay. Next, so in the nurses does not impose personal values on patients. ನಮ್ಮ ಅಪ್ಪ ಯಾರು ಗೊತ್ತಾ, do you know who am I, and who my father is, do you know who is my father, like these things, personal values is not needed on the patients and should not impose on the patients. And respect the individuality on the of the patient. So every patient, that may be poor or that may be popular or that may be rich, you have to respect each and everyone equally. That is called justice, right? What it we call justice. Okay. So that is also one of the thing we need to remember. Next, helps in providing the effective care when the patient values differ. Okay, some patients are so much arrogant, or some patients are so much appreciating, so that time you should not differ in the valuing the patient. So you should not take advantage also, you should not take disadvantage also. You should give the same value as the first bed the patient is taking, the same value should be got last bed patient also, right? Okay. Next, coming to the professional values, according to the American Association of the Colleges for Nursing, identified as 5 professional values, right? So what are the 5 professional values? First one is altruism. What we can say for that? Altruism means here the welfare and well-being of others. How that may be to the colleague, that may be to the colleague, okay, that may be to the colleague, or that may be to the patient, or that may be to the seniors. Okay, so you can think all these things, right? Okay, so welfare of the colleague, welfare of the patient, welfare of the seniors. So all things who are all there, they are present in the professional setting only. So you need to understand the culture and beliefs. So you need to understand what their culture and beliefs, and if they are doing like that, you leave it and you should do your own culture, and you should not take the culture into the consideration in the hospital. Okay, and you are not doing more thinking about that only. Clear? So culture, and you should accept the culture and belief of the patient also, and you should educate the patient, educating the patient, that means so not neglecting the patient. So this one is also altruism. Clear? And taking the risk on behalf of the patients. So you have to take the risk, and you should have to remove the risk of the patient also, right? So mentoring other professionals, that may be juniors or that may be your patient, you should mentor and health educate the patient. So that is nothing but altruism, right? Okay. Next, autonomy. Autonomy which will comes in value also, in ethics also. What is autonomy? So right of self determination. That means so you have a ability, you have a rights to make the self decision. Okay, what I said, decision making. Okay, if you have the decision making, you have a rights, that is autonomy. How it is reflected? By helping the patients, not all the things related to the professional thing. Okay, and family, in which one? Decision making. Yeah, first priority is the patient. If he is conscious, if he is unconscious, that time it will goes to the family members. But again, in the middle, the patient got alert, that time if he said something else and he was decided to not to give resuscitation, that time you should leave it. Clear? So that is nothing but what we can say, that is autonomy. Clear? Okay. So planning care with the patient, that is also decision making you are doing. Providing information for the informed choices, that is second one. Clear? Okay. Human dignity, you should respect the person inherent worth. Very importantly, this word, what is inherent means? Inherent means that is with heart. Okay, with the heart. So with the bottom of heart we can say, right? So that is, you should not do the fake. Okay, you should not do the fake giving value to the person. Human dignity, if you are giving not based on their richness, not based on their poorness, you should give with your heart, okay, to everyone. So if the poor is there, okay, you are concerning only poor, not for the rich, then it is also wrong. Clear? So respecting all patients and colleagues, protecting the privacy, maintaining the confidentiality, these are all reflects the human dignity. That may be patient dignity, or that may be colleague dignity, right? Next, integrity. What is integrity means? So accepting acting according to ethical code, that means you are integrating the rules and regulations with your acceptable standards also, you are including. How? So providing honest information. Sir, you have this much heart rate. Sir, you have sorry, you should not say sir, you should call by his name. Okay, example, Naveen, you have this much heart rate. Like that, directly you should inform. Honest information is needed, accurate documentation is needed. So what happened, that you need to inform. Okay, and you should not give the fake promises for the patient, right? Accepting the responsibility for actions, okay, and correcting the own or others errors. If someone like doctor itself, if they done mistake, you should correct it, or you should notify it. That is according to ethical code you are following it, right? Okay, that is integrity value. Next, social justice, upholding the moral, legal, humanitarian principles. All these will be called as social justice. Moral, so everyone has to equally get a value. So if you are saying sir to this person, and you should say sir to this person also. Okay, so everyone should get the equal values. Okay, so if you are saying the Mr. Naveen here, okay, here also should say Mr. something ABCD. Clear? Okay. And fairness, non-discrimination, equal access, quality healthcare, supporting the health-related policies and legislation. This is the social justice, right? Okay, coming to the ethics, the important topic, as we have said, right? So ethics means what is the study of the right or wrong conduct. Clear? It's a branch of philosophy where it will tells about the moral, based on the moral reasoning, and it will set a rules and regulations, right? So we already said that the standards of right or wrong in our personal own belief, that is moral. Due to the, that may be the individual, that may be family, right? That is moral. Help to determine the permissible actions, sorry, helps to determine the permissible action. Shall I is that good to do or not? That is permissible actions, right? Next, values. So beliefs or ideas a person feels strong about. Okay, very importantly, if you are not valuing the patient, then patient will never get cure, and he will curse to you. That's what you need to do. Okay, value you should give, right, to the every person. Next, ethical principle, very important for the NORCET also, for the SEM exam also. Autonomy. What is the meaning of autonomy? As I said, it's a self-determination. It's a right to make one's own decision. So here the nurse must respect the patient choice even if they disagree. Even the nurse disagrees, provide the information and support for informed decision making. What are the example? Patient refuses the blood transfusion, so blood, you need to administer the blood from the blood bank. You you have to administer the blood, so blood bag you have done. But after the full explanation also, the patient refuses, I don't need blood transfusion. So nurse should respect what? Nurse should respect the decision of the patient. Clear? Okay. This is also one of the example for autonomy. Next, patient decides to discontinue the life support. Very important. Okay, this is very important. Clear? So patient decides to discontinue. Now, so we will say DNR. What is that? Do not resuscitate. Resuscitate means, okay, so resuscitation means bringing back the from the life threatening situation to the minimal comfortable zone. That is resuscitation, right? So life supporting measures, it is advanced directive, and also DNR, which will, if the patient says discontinue, don't continue, okay, don't continue the life support, that time also we need to consider what the patient is telling, right? So DNR, we will say DNR. Clear? Next, patients select the preferred treatment option after being informed risk and preferred treatment option after being informed risk and benefits. Okay, after being informed also, they are opting the different option. Rather than opting the surgical, they are opting the medical treatment. So that time also you should not make them feel bad, and you should give according. So that time you should not say, so you have to surgical, otherwise I will not leave you. Like that you should not do. Once if they say okay medical, that time only you should agree, okay, you can go with the option of medical, right? So you have said risk, but still they are not believing, and they want to opt that one, then you have to. Clear? Next, coming back to the next one, we have discussed about the autonomy. Next we have to discuss the two important things, that is non-maleficiency and beneficiency. Why did I written the both? Because we need to understand both in a one hand, in one slide only, right? So do not harm. So if you are preventing from something else that is harm for the patient, that is non-maleficiency. And if you are increasing the if you are increasing the benefits, okay, that is nothing but beneficiency. So in this most of the time we will get confused. Okay, doing good and action should be benefit and to the client and must balance benefit versus risk. In this we will get confused more time. That's why I took what differences here. Okay, so what is the aspects here we need to look for? First, what is the avoid harm in the non-maleficiency? So actively do good. Okay, I will take it large, clear. Okay, actively do good for the beneficiency. What is the nature? So negative duty, if it is there, do not do. Okay, do not you should not do, clear. That is non-maleficiency, because negative duty is a negative duty. That means if anything is harming, risk prevention, okay, risk is there. So that time if you are not able to preventing it, then it is non-maleficiency, clear. uh, sorry, and that is maleficiency. Okay, you should do the non-maleficiency, means you need to prevent the risk, clear. So benefit maximization is the beneficiency, positive duty. Okay, next, priority in practice. That means which one we need to select first, non-maleficiency or beneficiency. In this one you should opt the non-maleficiency first. You need to check about the risk and benefit. Suppose risk is there, then benefit is also there. That time you should not go for beneficiency. Example, if the cancer patient is there, okay, for the cancer patient you are giving the anti-cancerous drugs, but side effect is also more. But if you give that drug, that will cures the just it's I'm telling, it may cure the symptoms of the cancer very rapidly. So for that you are giving the anti-cancerous drug. Okay, so that time you are in you want to increase the benefit, but there is an increase in the risk also by side effects. So that time you should you should not go with the beneficiency. You should non-maleficiency. Risk if it is more, then you should prevent the risk, clear. Okay, next, that's why you should look for the first obligation. First one is non-maleficiency, you need to check. If there is no risk, then go to the second, that is beneficiency, increase the beneficiency. That doesn't mean you should increase the dose. Okay, so just I give an example. Next, example for the phrase stop if harm likely. If it is harm, if it is going to be happen harm, then you should stop, clear. And intervene to help. Okay, someone is a COPD patient that time. So if the doctor is not available, then give the 1 to 2 liter per minute oxygenation for the COPD patient. Okay, legal relevance is strong link to negligence. Sir, what is this? Legal irrelevance means here the ethical, we are discussing about the ethical principles where we should prevent the risk and we should increase the benefits. When we are preventing the risk, that time if we are not preventing the risk, let it be, that time it is called negligence. Let it be happen whatever it is, that is negligence, right? Okay. And if you are intervening accordingly, the standard of care, it is linked to the standard of care in the legal relevance. What it does mean? So it depends what type of legal relevance it will comes. That may be negligence or that may be malpractice. Beneficiency may also lead to the malpractice also or negligence also. Okay, so this may happens. That's why they have given standard of care. What type of care you are giving, based on that it will link to the legal relevance. First ensure the non-maleficiency, then apply to the beneficiency, right? Okay, so now we will see what is the which one is the beneficiency and which one is the non-maleficiency. First, emergency surgery without consent. So emergency is there, emergency surgery is needed without consent, the doctor has done. So this one if we wait for the consent, that time there is nothing, like it is a non-maleficiency, so it will be called as negligence itself, right? So without consent they are doing the emergency surgery, it is emergent. Okay, unconscious is there, internal bleeding is there, and acting the patient's best interest is nothing but what? Beneficiency. This one is beneficiency. Clear? Okay, are you understanding how to do this one? Excuse me. Okay, next, stopping the chemotherapy, that means cancerous anti-cancer drugs. Clear? So anti-cancerous, that is chemotherapy is a chemical medications they may give you for as a treatment, that is chemotherapy, right? So they are giving the anti-cancerous drugs for the for that okay, your anti-cancerous drugs they are giving. But what happens, the side effect of the chemotherapy is more, or the toxicity is a severe due to the doses of more doses of anti-cancerous drugs in the blood. So that time, in order to prevent the severe toxicity, you are stopping the chemotherapy. That is nothing but you are preventing the risk. Okay, cancer treatment causing life threatening pans. Okay, what is the side effect, sir? So what happens if the severe toxicity happens? That will lead to all blood, WBC, RBC, platelets, everything will comes down. That is called pancytopenia. Anemia, decrease in RBC. Leukopenia, decrease in WBC. Thrombocytopenia, decreasing thrombocyte. All these penias will be called as pancytopenia. Pan India, you know, right? That is pancytopenia. So why it is happened? That is due to the severe toxicity. Why the severe toxicity happened? That is due to the anti-cancer drugs given to the cancer patient. So if you stop that, if you stop the benefit, if you stop the benefit, that time the risk will also reduces. That is stopping the benefit and risk will also decreases. That is all. That is nothing but what? Non maleficiency. Non maleficence. Okay. Okay, next, coming to the fourth one, that is justice. Sir, what is justice? Suppose here your friend is there and here your enemy is there, both have been admitted in the same bed. Okay, and you are being a staff nurse, you are uh, uh, treating the both person, sorry, treating the both patient, and you are administering the correct right dose and right medication to this your friend, but you are not administering and you are not looking at the face of your enemy. That time you are not giving the justice to the patients. So that is nothing but not unequal distribution you are doing. Okay, so justice means what? Even though if he is enemy, even though they are your friend, you are equally fulfilling their rights and their right of decision, right to make decision, and also their benefits and risk you are explaining them. That is nothing but what? Justice. Clear? So sometimes what happens, you may confuse with the beneficiency and also justice. Please do remember, beneficiency means you are increasing the benefit, not only giving the benefit, you are increasing the benefit already that are existed. Okay, that is beneficiency. Clear? Okay, now we'll see what is the examples is here. Free vaccination to all, what it is there, to all children in a community. Is this beneficiency or justice? All children, all children equally. Okay, equal distribution is there, then you are giving the free vaccination. Free means free vaccination to all means you are making the equal distribution, that is justice. You are making justice, right? So next, second one, administering the pain relief immediately to patient in a severe pain. Severe pain is there, you are relieving the pain. That means you are benefiting the patient. That is called beneficiency, right? Okay. So fourth one we finished. Next we will come to the fifth one. Fidelity. What is the meaning of fidelity? So fidelity means it's a faithfulness to the promise. Okay, some if the patient said you to, okay, it's not a fidelity, it's actually uh, you have done the promise for the patient. I will bring something else to you, and I will not tell to anyone. And if he is doing the same thing for up to the end of the treatment, then it is said to be. And if he keeping the promises, one word I can say, that is keeping the promises. Okay, so not fake promises, it is 100% promises that will be not abandon a patient without ensuring. Okay, if the patient give a excuse, that time only uh, he will do the promise. Okay, so that is what we can say fidelity. So keeping promises is a fidelity, and whereas telling the truth, okay, please do remember, trustfulness, trustful and trustworthy. Trustworthy is a fidelity. Truthfulness or telling the truth is a veracity. So here what happens, ethical dilemma will occurs. How, sir? So if you say the truth about a heart attack, that will okay, they will get harm also, they will get more anxiety. Okay, okay, if they are not telling the truth, that time also they will get only few days or few minutes or few uh, hours they will get happy, but afterwards they will get back to the healthcare providers itself. That is ethical dilemma. Okay, whatever it is, you should tell the truth. It may be harm or it may be anxiety, it let them it face. Okay, so that is veracity. Clear? So one by one we'll see. So we will confuse with this one also, fidelity and also the veracity. In this both, which one is confusing or which one is correctly we can mention, we'll see. So let we start. Okay, doctor 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 informs a terminally ill patient about the poor prognosis. Poor prognosis means the treatment is not efficient. That is poor prognosis. Despite the family asking to hide it. Okay. So doctor informs a terminally ill patient about the poor prognosis despite family asking to hide it. Okay. So doctor tells to the patient what he tells. So whatever the treatment we have given, whatever the treatment is given, it is not up to the mark or it is not succeeded. Okay, when he said these things, after family members of the patient said that you should not tell, you should hide it. So that time also he never make hidden, and he said to the patient, that is nothing but what he has said, truth. That is veracity. What we say for this, veracity. If he say truth, that is veracity. Clear? Next, nurse discloses a medication error. Very important. Discloses the medication error to the patient, even though it may lead to legal issues. Okay, so the nurse may get legal action on her, but still she has shown the honesty and disclosure. That means she said about the medication error, I have been administered the zone in the place of peptaz. So peptaz I need to administer, but in the place of peptaz I administered the zone. She is telling about it. So she is honest about the fact. So that is nothing but honest truthfulness is nothing but the veracity. What we can say for that, veracity, right? Okay, next, third one. Nurse refuses to share the patient details with the relatives. Okay, so patient details, like something the patient has taken the promise from the nurse, and the nurse is refusing with the relatives to reveal that details after pressurizing by their family. Okay, their family is pressurizing them, pressurizing the nurse to reveal, but she is not revealing that confidentiality. So that is nothing but that is nothing but what. So after keeping the professional promise also, she is not telling the she is not revealing it to the uh, family members, then it is said to be what? It is said to be fidelity. Okay, it is said to be fidelity. So next, nurse returns at the exact time promised to the administer analgesic even when ward is busy. Okay, so she has promised, very importantly, she has promised what she promised: after the busy ward, so this time I will come and administer the pain relief medication. And she said exactly at the time, and she came and she has administered the analgesic even though there is a ward busy. And she was trustworthy, and she was faithfulness her commitment, and she kept her promise to be alive, that is alive. So that's why she is called, she is having the ethical principle called fidelity. I hope you understood this one, right? Okay. So fifth one, accountability, being answerable for one's own action. So that is accountable, that responsibility once the nurse has taken, so the decisions or whatever the treatment she has given. So accountability or handovering to the next nursing officer. Okay, that is nothing but the accountability. Okay, or reporting to the patient, or sorry, reporting to the healthcare provider, or the telling to the truth, sorry, telling to the patient whatever the regarding health education is there. That is accountability, right? So autonomy is a self decision by the patient. He can self decide, he can make the self decision. Okay. Next, non maleficency, do not harm. Maleficency, that is let it harm, that is maleficence. Okay. Beneficency, do good. Justice, fairness to equal distribution. Fidelity, faithfulness and trustworthy. Veracity, truth telling, truthfulness. Okay. Accountability, answerable for own actions. Whatever she has done, she has to be action, she has to be tell everything. That is accountability, right? Okay, she means nurse, nursing officer, right? Okay, next, coming to the specific ethical issues. So organ transplantation act on 1984. So active euthanasia and passive euthanasia and DNR, assisted suicide, I will tell you here. Okay. So what is the euthanasia? First of all, euthanasia means mercy killing. Mercy killing. Sir, why we have to kill, why we have to kill the patient? We are not killing. So if we are killing, then it is said to be active euthanasia. What is a active euthanasia? That means the healthcare provider, healthcare worker or a nurse, okay, if they are providing that if they are decided to make mercy killing for the patient, then it is said to be active euthanasia. That is illegal now. Clear? So next, assisted euthanasia. So it is according to the American Nurses Association code, that is also illegal. Okay, that is also illegal. Assisted suicide means what, sir? So if we are doing it by irritating medicine, or by the making them to for reason for the death, that is active euthanasia by the healthcare provider. But so we are providing them, let them take, let the patient itself take the irritating medicine or killing medicine, or let that themselves they get die. Okay, that is assisted suicide. Assisted suicide or assisted euthanasia. So this is also according to the still it is in controversial. Assisted suicide is legal or illegal, that is still in controversial, but according to American Nurses Code, it is illegal, right? Okay. Next, passive euthanasia means what, sir? So here passive euthanasia means according to the, based on the WWLST. What is the meaning of WWLST? So withdrawal or withholding. Sir, what is withdrawal and what is withholding? Okay, withdrawal or withholding. So withdrawal means, so if the patient, suppose if I say the patient is taking the ventilated oxygenation, with that ventilated oxygenation support only, he was still alive. But if the patient is near to death, and if he is unable to get improve in the health status and it is a poor prognosis, already it is in the end of the life. So that time we have this WWLST, that means withdrawal. First one is withdrawal and second one is withholding. So withdrawal example I am telling you. So if you remove the mask, okay, if the patient remove the mask, that time withdrawal of the life supporting, that is ventilator assisted oxygen, that one also if you are removing. So that's for that one, due to that the patient death, that is passive euthanasia. Okay sir. Withholding means, okay, if you are giving some medicines like some emergency medicines, again and again you are giving the emergency medicine, atropine, adrenaline, you are administering every time, but still the patient is not becoming the stable, and if you are already you are already exhausted by giving all the medicines, and that also have a toxic level. Toxic means toxicity already occurred, so now it is impossible to give much more. So you have been stopped giving the medicine. So that is nothing but withholding the medicine or withholding the treatment to get peaceful death. That is mercy killing, we can say. Okay, so mercy killing only acceptable is passive euthanasia. Ethically is acceptable, but active euthanasia, doctor only making them to die, that is killing. Okay, that is will be called as murder, we can say. It is illegal. Okay, active euthanasia. What is assisted suicide? Then if they are getting, if they are not getting murder from the doctor, if they are getting murder from by themselves, that is assisted suicide. Okay, what is passive euthanasia? That means passive euthanasia means where the patient can die peacefully without getting the treatment or withdrawing the ventilator assisted. Okay, that is passive euthanasia. Okay, yes. So DNR means, I already said, do not resuscitate. If the decision making autonomy of the patient is do not resuscitate, and after the alertness he said do not resuscitate, and afterwards he gone for unconsciousness, that time also you should not do the cardiopulmonary resuscitation to get minimal assisted life basic support also you should not do. Clear? So whatever the treatment is there, that should be going on, like oxygen delivery, or that may be the whatever the medicines you are giving, that may be going on ongoing, that may be ongoing, but you should not resuscitate as per the decision of the patient, right? DNR. So hospice means if the patient is in the final stage cancer and he was already near to the death, that time you should give only the comfortable care, not cure. You can't able to cure them. That is nothing but hospice. Okay, next, legal implications in nursing. What are the legal implications? That we will see in the next class. Thank you for watching this video.